Welcome to an enlightening exploration of medications influencing the delicate balance of the endocrine system. In this section, we embark on a journey to understand how drugs play a vital role in restoring hormonal harmony and addressing various endocrine disorders. Each section unravels the mechanisms of action, commonly used medications, potential side effects, contraindications, and tips on identifying these medications. Join us as we delve into the pathophysiology behind each disorder. Drug therapy for diabetes mellitus. Pathophysiology. Diabetes mellitus arises from impaired insulin function, causing elevated blood glucose levels. This disruption affects metabolism and can lead to complications such as cardiovascular disease, neuropathy, and nephropathy. Mechanism of action. Medications manage diabetes by enhancing insulin secretion, sulfonylureas like glipizide, improving insulin sensitivity, metformin, or decreasing glucose absorption, SGLT2 inhibitors like canagliflozin. Insulin injections directly regulate glucose levels. Identification tip. Look for sulfonyl in drug names for sulfonylureas, gliflozin for SGLT2 inhibitors, and met for metformin. Commonly used medications: metformin, insulin, glipizide. Side effects: hypoglycemia, gastrointestinal disturbances, and potential weight gain. Contraindications: kidney dysfunction, liver disease, and specific medication allergies are essential to consider. Drug therapy for hyperthyroidism and hypothyroidism. Pathophysiology. Hyperthyroidism stems from excessive thyroid hormone production, leading to a faster metabolism, weight loss, and palpitations. Hypothyroidism results from low thyroid hormone levels, causing fatigue, weight gain, and depression. Mechanism of action. Methimazole, a thionamide, inhibits thyroid hormone synthesis, managing hyperthyroidism. Levothyroxine, a synthetic T4 hormone, supplements thyroid hormones in hypothyroidism. Identification tip. Thio, in hyperthyroidism drugs, and thyroxine, in levothyroxine. Commonly used medications: methimazole, levothyroxine. Side effects: skin rash and agranulocytosis for methimazole, palpitations, nervousness for levothyroxine. Contraindications: pregnancy, breastfeeding, and specific medical conditions need careful consideration. Chapter 43. Drug therapy for pituitary and hypothalamic dysfunction. Pathophysiology. Pituitary and hypothalamic dysfunction can disrupt hormonal regulation, affecting various body functions. Conditions like diabetes insipidus and hyperprolactinemia result from these disruptions. Mechanism of action. Desmopressin, a vasopressin analog, is used for conditions like diabetes insipidus and nocturnal enuresis. It can cause water retention and hyponatremia. Bromocriptine, a dopamine agonist, manages hyperprolactinemia. It might lead to side effects like nausea and dizziness. Identification tip. Unique names for pituitary and hypothalamic drugs. Commonly used medications: desmopressin, bromocriptine. Side effects: water retention, hyponatremia for desmopressin, nausea, dizziness for bromocriptine. Contraindications: kidney dysfunction, specific medication allergies should be taken into account. Drug therapy to regulate calcium and bone metabolism. Pathophysiology. Imbalances in calcium and bone metabolism can lead to skeletal disorders like osteoporosis, fractures, and bone pain. Mechanism of action. Medications in this arena enhance bone health by regulating calcium levels and bone turnover. Alendronate, a bisphosphonate, inhibits bone resorption. Vitamin D supplements aid calcium absorption. Identification tip. Unique names for bone health medications. Commonly used medications: alendronate, vitamin D supplements. Side effects: gastrointestinal disturbances, esophageal irritation for alendronate, hypercalcemia, kidney stones for excessive vitamin D. Contraindications: esophageal disorders, specific medication allergies should be considered. Drug therapy for Addison's disease and Cushing's disease. Pathophysiology. Addison's disease involves adrenal insufficiency, leading to fatigue, weakness, and weight loss. Cushing's disease results from excessive adrenal hormone production, causing obesity, muscle weakness, and skin changes. Mechanism of action. Hydrocortisone, often used for adrenal insufficiency, can lead to adrenal suppression and immunosuppression. Ketoconazole, an antifungal, is used in Cushing's syndrome to inhibit steroid synthesis. It may result in liver dysfunction and skin reactions. Identification tip. Unique names for adrenal disorder medications. Commonly used medications: hydrocortisone, ketoconazole. Side effects: adrenal suppression, immunosuppression for hydrocortisone, liver dysfunction, skin reactions for ketoconazole. Contraindications: active infections, liver dysfunction. Specific medication allergies need to be considered. Exploring both the pathophysiology and medication management arms healthcare professionals with comprehensive knowledge to address endocrine disorders effectively. Stay connected with us for more insightful medication education. Subscribe and activate the notification bell for the latest updates from Wally's Nursing Videos. Your commitment to learning and providing exceptional patient care is highly commendable. Until our next educational episode, stay well and stay inspired.